So this is our faculty staff school reopening health and safety training. Thank you all for participating in this. So I would like to thank you for your time today. The presentation is a bit lengthy, so just bear with us here. We are recording this training and it will be available to all faculty and staff. These slides will also be posted on the COVID resources on our webpage, so you can access them at any time. We're doing this presentation as a webinar style with Q&A at the end. So go ahead and save your questions until the end because there's a lot of information that I'll be going through, and I think it may answer some of your questions. And we're going to go ahead and answer all questions as they relate to COVID health and safety policies and protocols. We're asking that any instructional and curricular questions be asked during the hybrid training model. And at this point, I want to say a huge thank you to Rachel. Over the past couple of months, she's been working very diligently, and I kind of put her through the ringer this past month and made her work every single day in the month of December, including weekends and holidays. So I appreciate that you put as much of the commitment into this. Thank you. So what we're going to talk about today, the introduction of the new COVID team staff. Marianne mentioned it, I believe, on our Monday call, but I'll introduce them to you again. 4 pillars of health and safety, COVID testing. We're going to have a presentation by our school nurse, our classroom management, passing periods, lunch, entrance and exit plans, contact tracing, quarantine, and key definitions, and other. So our new COVID team is, we have our school nurse, Bridget Wiley. She's a registered nurse. She's located in the front inner office, and her extension is 303. Our NDB child care associate, who's going to be hanging out with our faculty kids that have signed up for their child care, will be located in the soda fountain. And she's going to be responsible for the on-site of all the NDB staff, faculty staff, grade level children that have signed up. And her extension is 500. And then our new COVID associates, as mentioned by Marianne earlier this week, we've got Megan Dillon, Sana Zumot, Paul McCallion, Caitlin Marino, and Joshua Duty. I also at this point want to mention that we've hired 5 new maintenance personnel that will be working during the day to ensure constant sanitation and cleaning. And our Epicurean team, we will have 4 Epicurean staff returning, and they're very excited to get back to work. Some of them having struggled so much over the past couple of months, and we're excited to have them back. So on to our next slide. Okay, all faculty, staff, and students, we're going to talk about masks, must wear clean masks every day. Masks are required at all times unless you are alone in your classroom and office, or if you are eating at designated eating areas. If you are using a face shield, I just want to remind you to please make sure that you disinfect it after each use. It's very, very important. So, limited gatherings. We will not be meeting in person as a group for a minimum of 6 weeks. All meetings should happen via Zoom, even if it is a small group. After 6 weeks, we will assess the safety of holding small meetings spaced 6 feet apart. There's no visitors, no volunteers will be allowed on campus for a minimum of the first 6 weeks. We won't be having in-person guest speakers as well during these first 6 weeks. After 6 weeks, we will reassess whether it is safe enough to have other people come in. Of course, all those individuals coming in will have to receive some sort of COVID training to ensure that they are following all of our policies and protocols. No in-person field trips will be allowed during the second semester, but you could go ahead and do as many virtual field trips as you'd like. Physical distancing. All hallways are marked with one-way signs. Faculty and staff are allowed to move freely through the hallway when no students are present, and that's very important. So our hallways are long enough that if you stand against either side of the wall, you will be 6 foot distanced. But with students, we're not allowing that because we don't feel that they will be able to stay against the wall. So we are making all of our hallways one way. It's up to you. If you don't see anyone in the hallway, it's clear, you go ahead and go the wrong way. No one's going to be upset about that. But if you do see a student, just maybe wait until they pass and then you could go on. But while students are present, we ask that everyone in the building follow the one-way markers and just go one way. It is up to the teacher's discretion to get closer than 6 feet to a student if it is required to assist them with something briefly. You should not be closer than 6 feet for more than 10 minutes at a time. You should also ask the student to make sure they are comfortable with you approaching them closer than 6 feet. For example, you may say, "Is it okay for me to come close and briefly show you how to cut open that frog, maximize visibility. Not really sure if frogs are still a thing, but just if in case they are, that's an example that I wanted to use. So, but go ahead and ask the student if they're comfortable with it, because we want to make sure that everybody's comfortable with it. Okay, moving on. Health and hygiene. So most of you, I believe now, have the health screening app. All faculty, staff, and students will be required to present the cleared entrance screening on the NDB app upon arrival. Anyone not presenting the cleared screening app will not be allowed to enter the campus. Upon entering, everyone should sanitize their hands unless they have had a special accommodation that has been previously discussed with either myself or HR. Sharing of materials and printing devices are not allowed. If you need to print, please send your printing job to Myrna Yao or Alejandra Arias. Please allow 24 hours for turnaround. Faculty and staff cannot print directly to shared printers. And those are the printers that are shared with others. Okay, next slide. COVID testing. Faculty and staff are required by the state of California and San Mateo County Office of Health and Education to be tested. We will be tested weekly on Monday, unless it's a holiday, then we'll do it on Tuesday, to ensure a routine schedule is followed and test results are received by the start of the following week. We are required to keep the testing data for our records and provide proof if anyone ever asks. There's two primary reasons we're doing this testing at school. First of all, when faculty and staff are on campus, it's very convenient to just go on downstairs, see our school nurse and grab your swab, do your test. Better than driving somewhere else to have to do a test. And then the system that we're using allows us to track the testing and provide reports as needed showing proof of testing. Now I want to make a note here. The only information the school receives from Curative is the name of the person doing the test, their date of birth, zip code, the date tested, and the results of the test. The information that you use to create your Curative account, that information is not related to the school. Students will be tested weekly on a routine schedule. Students who have not been tested will not be allowed to come onto campus. We have partnered with Miramis for student testing, and we're going to begin that at least a week before they are scheduled to arrive on campus and every single week thereafter. Our new school nurse, Bridget Wiley, will coordinate and lead all the testing with the support of the COVID operations team.
Good morning, everybody. I've introduced myself a couple of times, but I'll just do it one more time in blue and white. My name is Bridget Wiley. I have been a registered nurse for over 25 years. I've worked at all teaching hospitals, such as UCSF, Stanford, but I've also worked all over the country. I always wanted to work in teaching hospitals because I love the idea that they're always getting the newest material. They're always doing the newest protocols and stuff. So I always stuck with teaching hospitals. I specialized in pediatric hematology oncology, pediatric emergency, and neonatal intensive care. I also founded and operated the first mildly ill childcare center in the Bay Area. Some of you may know it. Under the Weather, it was on El Camino and 25th. I operated that for 5 years and then sold it. And if you have any questions or concerns, please contact me. My email is there. Sorry, it should be BW, all one word. And again, my extension is 303. So a plan, basically what I've been doing over the last 2.5 weeks is reviewing everything that's already been done. And I have to say that since the summer, last spring, the COVID team has created protocols based on the guidelines from the CDC in San Mateo County. They are really thorough. There really is not many, I couldn't find any I's that weren't dotted or T's that weren't crossed. One of the things that Notre Dame did was they hired an on-site nurse to assist with ensuring the safety of all the staff, faculty, and students. One of my responsibilities will be that when anyone is absent, I will do a complete assessment of the cause of their absence. For example, we have somebody who is a family that is traveling right now. Well, even though they're not ill, I am going to speak to the family. I'm going to make sure that they understand that they need to quarantine for 14 days when they come back. And then their daughter can be tested, and then their daughter can come back once the test is positive. So it's more than just, are you sick? Obviously, we will do everything we need to do if we get a report of a staff or a student being sick, and I will report the contact tracing when necessary. But just so you know, we are also, I'll also be involved if anybody is absent, and make sure that they are safe to return, and I will make it very clear when they are safe to return. I will be doing the weekly testing of staff and students. We're going to be applying all the rules of the county, including travel, quarantine, and isolation. Per the San Mateo County Health Department, travel right now means outside of the 9 counties. So that includes Tahoe. If you go to anywhere outside of those 9 counties, you are supposed to quarantine, and it is for 14 days. There's been some discrepancy where some organizations like CDC has been saying it could be 7 to 10 days. San Mateo County is 14 days, and it will stay like that. There is a difference between quarantining and isolation. Quarantining is a period where you are waiting to see if you are symptomatic. You have not been around anyone who's symptomatic. And isolation is when you have been with somebody who is positive, or you've become positive. You need to isolate. You need to separate yourself from everybody, including in your home. And it would mean that people in your home would be wearing masks. And I'm happy to discuss the differences of those later on if you need it. We are going to monitor and adjust to the current situation in our county. Right now, things are getting slightly better, but we're also waiting for the surge. And I keep very close tabs on that. I keep close tabs on the positivity rate. I keep close tabs on the ICU beds, and I keep track of whether we're in the red or the purple. And so, you know, what is going on out there, I'm aware of, and we're doing everything we can inside our small environment to make sure that everybody who comes in is safe. The last point of this for the plan for return is the contact tracing and reporting to the county. One of the goals is to have a relationship with the county, and you know, so as they're giving out new information, we're getting it. We're aware of any changes, of anything else, but contact tracing and reporting to the county is super important. And the contact tracing is really our responsibility, or my responsibility is just the contact tracing from the school. What happens out there, the county will take care of. But my focus is figuring out where this student or staff have been and who they've been in contact with and how long they were in contact with them. So that will be, that is the last part of this slide. Thank you, George. These are from the CDC, the CDHP, and the, well, that's just be San Mateo County Public Health, sorry, not a C. The state, they state that wearing a face covering when combined with physical distancing of at least 6 feet and frequent hand washing significantly reduces the risk of transmitting coronavirus when in public. Those again are those 4 pillars, right? Hand washing, 6 feet apart, a mask, and obviously checking for symptoms and things. And the other thing is that, you know, like many things, treat everyone as if they are an asymptomatic positive person. And that will protect you, and that, you know, so just, you know, keep your distance. Hand washing is just, that's one of the keys. So I'm going to go into the next slide. All right, so let's talk about masks. Some masks are better than others. So let's make sure that your mask has 2 to 3 layers. 2 is okay, but 3 is better. The ones that have 3 layers will have a little filter inside. Some masks have a little slit that you can actually pull a filter in. You want them to be tightly woven fabric, like cotton or cotton blends is best. Paper masks with 3-ply are fine. They should be replaced every 2 to 4 hours. The masks that we have at school are 3-ply, and that was one of the, yesterday there was, I just want to make sure that people know that there is a difference in quality. These are not surgical masks. We're not taking masks away from hospitals and clinics, but you can see on the boxes that and you can see in the quality of the mask that there is a difference. If you can buy 500 of them for $12, chances are they are not a 3-ply mask. I will have plenty of 3-ply masks in my office. The other thing is to replace them. So if you sneeze into them, or you cough, or you take them off, you know, when between classes and stuff, you should put on a new one. One of the things that I'm going to suggest is that people bring a paper bag, and when you're done using your mask, you put it in your paper bag and then put the whole paper bag in the trash, so that we don't have dirty masks falling out of garbage cans like we do sometimes with paper towels in the bathrooms and stuff. So everybody, if you could bring like a little lunch bag, and that becomes your own personal bag, and you can put your dirty things in there. One thing about mask, make sure that it fits. There is a difference in sizes. I am small, and I don't have a big head. And but if I was to wear a large mask, I would have gapes on the side of on the sides here, and that is indicated. One of the other things a lot of people have problems with is fogging. If you've got glasses, you'll see that a lot of people will fog. So one of the ways to prevent that, I have homemade masks, and there's the nose, the bridge of the nose here is a nice thick piece of pliable aluminum. And so when you put it on, you snap it in around your nose, and my glasses don't get fogged up. So if that's something that is a problem for you, that would be it's a great solution. And there are masks like that out there. If anybody wants a pattern to make this particular one, my spouse has made over 2,000 masks and switched over after about 900 to this type, and it is truly the best. You can talk, it doesn't move, it's very nicely closed in. So if anybody wants this pattern, I'm happy to share that with you. The other thing is no valve masks. That is a CDC requirement and a San Mateo County requirement. The valve masks actually let stuff in and out. So we will not allow any valve masks on site. Goggles and shields. So one of the other ways that COVID can be transmitted is through the mucus of your eyes. So if you feel more comfortable, you can totally wear a shield or goggles, or if you wear glasses, that is a good thing too, but it does not replace a mask. So if you were wearing goggles and a face shield, you still have to wear a mask. Okay. We did see, if you wear one of those shields, there might be a protective lining. Somebody came in and had been living in the fog for the last day because they still had that film on top. So someone took it off, and all of a sudden she could see brightly. So it was great. So yeah, so if you feel more comfortable with those, I have shields. I can work on getting goggles as well. Okay, next slide. The best practices. So washing your hands with soap for 20 seconds several times a day, especially before and after eating. So if you've got stuff on your hands and you start eating, that's when you're going to start putting things into your mouth, and that's a great way to transmit things. So definitely washing your hands well for 20 seconds several times a day. Use hand sanitizer between hand washes. There's sanitizer everywhere. Wear a well-fitting 2 to 3 ply mask, take it home daily in a paper bag, and wash it before using it again. One of the things that I suggest is if you wear a smock or an upper covering that you can remove at the end of the day, bring it home again in a paper bag, and then wash it before using it. It's something that we do in nursing a lot, especially if we're working with patients that are contagious. Like we'll have separate shoes, we'll have scrubs, we walk in the house, strip down, put all of that away, and then put on our house clothes. That could be a good barrier between your work and your home. You can separate them both. But wearing that that smock or a covering on top, an extra shirt, and you just make that sort of your outer covering. Keep that on all day that you're here, take it off and bring it home. Use provided sanitizer spray to clean surfaces between uses. The sanitizer that we have meets all the requirements of the CDC and the San Mateo County. And it sits, it doesn't necessarily have to be wiped off, but I think we're going to go and do a more in-depth talk about that. Stay 6 feet apart. I have to say that this is the trickiest of all because everybody has an idea of.
Wait, Bridget, because I think there's some practical questions about masks. Why don't we just deal with those right now?
Sure. Should I go into the Q&A?
Yeah.
All right.
I could tell you what they are if you want me to do that.
Okay.
You know, starting from the bottom up, you may have just said this and I missed it. Are neck gaiters effective or allowed?
Well, the thing with gaiters is that they're single ply. And, you know, people use them when they're hiking or they're walking their dog, but they do not meet the standard for a 2 to 3 ply. So they are not acceptable at school.
Okay.
Some people have started to double them up, but they're not.
All right. Good answer. Good. Thank you. Can we purchase masks from you?
Well, we have not, my spouse has not sold any. She's given $1 million away. She's given 2,000 away, but let me see about what we can do in order to, maybe we have, I don't know, does the school have a sewing club?
Well, Helen has a sewing machine, I know.
Okay, so we will, just send me a private message or email me and let me see what we can do, okay?
Okay.
If we do have some people that can sew, maybe they could sew for 2 people. So maybe we'll form a sewing committee and see what we can do.
On the topic, I thought we had purchased this. Can masks and paper bags be provided to each teacher? Rachel, have we done that?
Yeah, so I think it's just
so
the paper bag that we need to get together.
Okay.
Yeah,
Absolutely. We'll buy a big quantity of paper bags and we have masks on hand already.
And I know this has been discussed the last several months. If teachers buy scrubs or other smocks, we will most definitely reimburse you.
Okay.
So I think those are the only, I just wanted to do the mask questions because they seem very practical before we move on. But the other questions here will be addressed as well.
I can address the one that says on the contact tracing slide right now. If we aren't doing seating charts, how will students be able to effectively trace their contact?
I'll be discussing that a little bit later under classroom management.
Okay. Yeah.
So we can.
Okay. So what about gloves? I love gloves. I think gloves are very, very useful. I will be, if you are in the practice of washing your hands and hand sanitizing in between, that is really all you need. I will only be wearing gloves if I am physically touching somebody or when I'm doing the testing. That's the only time I will be wearing gloves, or if, you know, I have to clean something up or something like that. But hand washing and hand sanitizing are really the 2 top tiers of prevention. So I hope that helps. Is that it for masks and gloves?
There's one more question with masks. Our Notre Dame masks are 2-ply, but I know Bridget's looking into putting in a filter inside of it.
They are 2-ply, and what I'm going to look at to see is if somebody wanted to make it a 3-ply and we were to cut that inside lining. What I worry about with that is that now you have an open seam. So I'm going to look into that, but they are 2-ply, so they do meet the requirements, and we do have plenty of them on site. Okay.
So let's move on to the next slide.
Okay.
Classroom management. So I'm going to go into classroom management at this time. Classroom doors and windows will be open each morning by maintenance. The purifiers will also be turned on at least 1 hour prior to the start of students arriving on campus. Bathroom usage. This is something we've considered quite a bit. We think it's preferable for students to go to the bathroom while in class so that during lunch, we don't have a huge backlog of students trying to get into the bathrooms. Same with during passing periods. There's going to be people in the hallway, and having them wait for the bathroom outside is not ideal. So we think it is preferable for students to go to the bathroom when they're in class. If teachers need to go to the bathroom, they should use their class phone and call Barbara, and she will send a relief person to your classroom. You could use that not just for the bathroom, but if you need a break, go ahead and call Barbara. She'll call a COVID associate or a staff person over to your classroom where they can sit with the class. Maybe they're working on an assignment, and we could relieve you for as long as you need a break. And then that substitute will remain with the students that entire time. If a student would like a water break in class, have them step into the hallway, take a drink from their water bottle, and return to their seat after they have placed their mask back on properly. If you as a teacher have a room full of students and you want to take a sip of water, I'd say go ahead and just head to your door, face the hallway, take your drink of water, and then put your mask back on and continue on with your day. Touchless water bottle refilling stations are located throughout the school on both the first and the second floor in the hallway. The staff lounge and staff supply rooms will be closed for now for at least 9 weeks to ensure that we're not touching the same materials as each other, and that we're able to find a good way to disinfect materials before people are in there touching everything. Please note that if you are not comfortable using the touchless water bottle refilling stations that are also used by the students, we encourage you to just bring a really large water bottle to hold whatever water you need for the day. I have this big, enormous thing that holds my 8 glasses of water I need to drink during the day. So that's what I'm going to be bringing with me. On to the next slide. Sanitizing desks. While the county wants teachers to disinfect desks for themselves after each use, we want to give you some options. We are putting in a spray bottle of BioEsk botanical disinfectant spray in your classroom. This disinfectant, and then what you can do is you can go ahead and spray the desks and the chairs yourself. You don't need to wipe them clean. This disinfectant is not toxic, does not require the user to wear any special PPE to spray. It does not need to be rinsed and can be allowed to air dry if time permits. It has a 4-minute dwell time to kill the coronavirus. If extra residue remains, if a student wants to wipe it down with paper towel themselves, they can do so. And I've gone in and tested how long it will take to spray desks in, I believe it was 15 seats. It took me about 1 minute and 30 seconds. So that's a pretty convenient way, I think, to disinfect these desks and chairs without having to touch anything. You could also, of course, you can always sanitize the desk yourself using a wipe. We could provide you with gloves. Just let Rachel know your glove size. We're happy to provide those for you. And I know that in the past, teachers have always had students use disinfectant wipes to wipe down their desks from time to time, or whiteboards or whatever it is. We don't want to take that practice away from you. So if that's something you still want to do, feel free. Classrooms are going to be disinfected at the end of each school day by maintenance using an electrostatic disinfecting spray machine. All right. For classrooms with carpets, there are carpet circles indicating the location of each desk. For classrooms without carpet, I believe we have blue tape indicating the location of each desk. Don't move the desk. If you have to move the desk, let us know. We want to just make sure that we could have somebody from maintenance over there to move the desk for you, and then we can ensure that it stays 6 feet apart. We're happy to redesign your space as you wish, but we'd like to make sure that the desks that the desks are the proper distance. And just keep in mind, it's head to head. So if a student is sitting in a chair, it's 6 feet from where that student's head is to where the next student's head is, not necessarily from the tip of the desk at the very end to the beginning of the back of the chair in front of them. It is from head to head. All right. So don't assign students seats. Instead, have students fill in the back seats first, then the row in front until all desks are occupied. You do not need to keep a seating log. And then go ahead and dismiss students from the front to the back. And I saw a question about, well, how will you know for contact tracing purposes if who they were sitting next to? The county has, the county in the full spectrum of being as conservative as possible. While it is true, if you're not closer than 6 feet to a person in a normal scenario, you would not normally need to quarantine. The county is requiring schools that if anybody's in the classroom with them, even if they're complete opposite 20 feet away from you, the whole class will quarantine if there is a case on campus. So, and then any classes that that student is in will also quarantine if that's assuming that the student has COVID. And I'm going to go through scenarios for you of exactly how that works in a couple of slides and it kind of show you all the rules around that. All right, other student PPE management. While students are in the classroom, we're asking the teachers to be responsible to ensure that the students stay 6 feet apart. You know, just make sure that they work independently at their desk, or if they do work with others, that they stay 6 feet apart. Properly wear their masks in the classroom. If you see a kid without their mask pulled all the way up, say, hey, just reminder, pull up your mask. If you find a student is uncooperative and is not following the rules, please contact Alicia Bergholm and we will deal with the student directly. If a student needs to leave the classroom for reasons other than a quick mask readjustment, which can be done in the hallway, the bathroom, or a water break, if it's for reasons not related to physical illness, call Barbara at extension 201 from your class phone, and she will have a COVID team member meet the student outside in Father Downey Garden. If it is physical illness, like say the student gets a bloody nose or something, call Barbara at extension 201. She's going to get in contact with Bridget, our school nurse, and our school nurse will then meet that student and work with them on whatever issues and symptoms they're having. Please note, students are not allowed to visit other classrooms. They're not allowed to visit counseling, teachers, or staff offices at this time. We will reassess this about 6 weeks in. Next slide. Students are required to bring a filled water bottle and a fully charged laptop daily. We are going to be communicating to the parents and students at the mandatory parent and student training this information. We are also going to provide them an option if they want to purchase a laptop charger. Linda has identified one that would be really good for continuing to charge your laptop at school. So that is something that we're going to be talking to the parents about, as well as the students in their trainings. So the school is going to be very cold during the winter months. Students, faculty, and staff will be asked to dress warmly and in layers. The radiators are on, but will not likely heat the space effectively. There is a problem with our electricity as the building is very old. If we use space heaters in all the classrooms, it is likely that the school's electrical system will explode and possibly cause, I hope not, but it possibly could cause fires and definitely will short out the electricity in our entire building. We also ask that you don't bring any unnecessary devices to the classrooms. Just the more stuff you have, the more risk of touching and having to disinfect and more items. All right, next slide. I'm going to hand this over to Rachel.
Okay, great. So for passing periods, students will be dismissed on a staggered schedule, and the classrooms will be organized in 3 different groups, and they will be dismissed 3 minutes apart for after every block. Each student will exit school after class, so everyone will be exiting the building fully, and there'll be 2 circles that they'll be following, one through the Father Downey Garden and one through the junior parking lot. And since each break is 15 minutes, they will be outside for about 10 minutes and then they'll head back in, so everyone will have time to do the sanitation of their classrooms. You can see these maps on our COVID website to see exactly the circles that I'm talking about and the one-way flow of all the traffic in the halls on all 3 floors. In addition, we'll be posting in the classrooms the staggered schedule, so it'll be very easy for all teachers to know exactly when their class should be dismissed for all passings and lunch and end of day dismissal. And those should be posted by this Friday, because we're finalizing it right now. And then class dismissals will also be announced on the intercom for each period or after each block. And then we're also placing stanchions in the hallway so students can't go the wrong way. And then if we go to the next slide. This is an example of the piece of paper that will be posted on your door, so you know exactly where your students will be exiting and then re-entering the building, and then also how they should get to lunch, because lunch will be on the front lawn, but we'll discuss that, or on the lawn, but we'll discuss that on a later slide. And then there's also the dismissal times listed and the different groups. So then Barbara will be announcing the dismissals each block by group number, so she doesn't have to list off every single classroom in that group. And then there's also an end of day dismissal, so all the students know exactly when they're allowed to leave the classroom and where they're supposed to go. Next slide. So during passing periods, the hallways, bathrooms, and outdoor walking paths will be supervised by our COVID team, as well as other staff. And occasionally faculty members might be asked to help if we need more supervision. And students will not be allowed to gather at any time indoors or in the common areas. So when we're doing these passing periods, we'll be watching to make sure everyone's staying 6 feet apart and following the correct directionals. The dining room will be used as a study hall classroom, which will be supervised by Myrna until we're able to open it for lunch, which will be determined in a couple weeks. And then all administrative team members, COVID team members, staff members, and other non-teaching faculty will be placed on a rotation of supervisions, which is going to be managed by Patsy, and we'll provide the schedule at least a week and a half in advance for people to sign up. And then teaching faculty members will also be scheduled for supervision during this time if needed, but only if you don't have a class before and after, because obviously you need that passing time to clean the desks. Okay. So moving on to lunch, we're going to have pre-packaged boxes for teacher and student lunches, and they will be delivered to classrooms at the end of block 2 and end of block 7. Each lunch will have a student name on it, and teachers can determine in their classrooms how best to hand out these lunches, but they will be delivered to the classrooms by the COVID team and Epicurean. So Epicurean will have a Notre Dame Cafe website, which we will all register for, and the registration includes your name, cohort, and email. And then once you register, you'll be able to log in each week and pick the lunch that you would like to order for yourself for the days you're on campus. And at this time, there'll be no lunch on Wednesday until we are, doing things on campus on Wednesdays. And the lunch orders must be placed by the previous Wednesday for the following week's lunch. Instructions should be emailed out this week or early next week. And if you do not place your order on time, you will have a selection made for you based on your settings, which, vegetarian or just regular. And then if you have any food allergies beyond being vegetarian, please email the other Rachel with her email, which is linked below. And I believe there'll be a hot option, a cold option, and a salad option, at least for the first few weeks, that you can choose from online. So while we're in the purple and red tiers in San Mateo County, we will be eating outdoors, and lunch supervisions will be comprised of all members of the faculty and staff community. And those will be shifts of 20 minutes. So there'll be 3 shifts for lunch supervisions in various places outside, in the parking lots to make sure, students aren't wandering, and then also in the building to make sure students are not trying to get back into the building during lunch, since we're all going to be outside. Schedules we put out a week and a half in advance as well, and Patsy will be managing the supervisions for this as well. If for some reason you sign up for a shift and then can't make it, please let myself or Patsy know right away, and do your best to find a replacement. So do you want me to explain the rainy days, Carolina? Or okay, so for rainy days, rainy A days will not be on campus and will be online distance learning days for everyone. And we will call it 24 hours in advance if rain is predicted by weatherchannel.com for Belmont. This is mainly because obviously we don't have a place to put everybody for lunch indoors. And it's really important to be eating outdoors because people are taking off their masks. Okay, so lastly, the entrance and exit plans. Faculty will be required to arrive on campus and be in their classrooms by 8:15. And students will be arriving on campus starting at 8:15 based on their last name. Students will also be dismissed by their last name but on the opposite schedule. So those students who arrive earliest will get to leave first at the end of the day. All faculty, staff, and students are required to show the cleared to enter campus screen on their app each morning. And students and staff who do not have not done the app must complete the screening outside of the building and then come to the entrance to have their temperature checked by one of the COVID staff members at the entrance doors. So faculty and staff members who arrive before 8:15 should enter in the west main entrance, the entrance near the parlor, and then show your cleared to enter campus screen to whoever's at that front door from the COVID team. If the screener is not there, then please show your cleared to enter to Barbara or Myrna. And if you're, yeah, perfect. And then it looks like if you enter too early and there's not a staff member there, please just email a picture of your check mark to Barbara. Okay. So at each entrance, there'll be hand sanitizer. So everyone will be taking that once they're cleared to enter. And then we'll also be checking to make sure everybody's mask is on their face correctly. Faculty may leave school when all students have left their classroom. The last staggered dismissal is 3:05 on A days and 12:55 on B days. And this is flexible though, based on if we have any issues with dismissal and overcrowding, especially for those who are getting picked up out front by a parent. When school is over, please depart campus because as soon as possible, because we will be spraying and disinfecting all classrooms right after school ends. So we plan on using the COVID team personnel, non-teaching faculty, and staff members to assist with the arrivals and dismissals, which is mainly supervising out front to make sure all the students while waiting for their parents are spaced out appropriately. And we may need additional assistance to help with that. If you don't have a morning block or a 5th or 7th block, and these schedules will also be put out at least a week and a half in advance. And we thank you for everyone who volunteers to help us with this arrival and dismissal.
All right, so from here, I am going to go through what contact tracing, quarantine, and key definitions are. I'm going to ask George for now to click on the green scenarios link there and open up this page for me. And I'm going to talk about what these key definitions are and take you through all the scenarios. Take you through all the scenarios when he pulls it up for us here. All right, so first I want to do some clear, what are these key definitions? A case refers to a person. Well, first of all, let me stop myself. This document itself is on our webpage. If you want to open it to see it larger yourself, you could go to ndhsb.org, click on, there is a little link that floats in the middle. It's called Coronavirus Community Updates. You click here, you scroll down, and under COVID-19 health resources, at the very bottom, it says COVID contact tracing and scenarios. You can click on that link on our website and it will open up the document for you. And so you can also at any time take a look at it. So for definitions, a case refers to a person who tests positive for COVID. It's very important to understand what the definitions are in terms of our work as it relates to contact tracing and who's an indirect contact versus a direct contact. A close contact is a person who is within 6 feet of a confirmed case for more than 15 minutes, regardless of if they're using a mask or not. An indirect contact is someone who may have been in proximity to a close contact. And so from here, I'm going to go into the scenarios. Scenario 1, this is what we would do to take the steps that we're going to take in response to confirmed or suspected COVID-19 cases and close contacts known to known COVID-19 cases. So those are people who say, my daughter has COVID, I am a close contact to a known COVID-19 case. And so that I'm gonna go through these scenarios pretty quickly for you, but remember, you can always go back and revisit it on our webpage. Scenario 1, a student or staff member either exhibits COVID-19 symptoms or answers yes to a health screening question or has a temperature of 100.4 or above. What we would do is we would send them off course to Bridget. who would then send them home. We'd recommend testing if positive. We'll go through the other scenarios, and if negative, there's a second table that we would apply that we'll go through if they test negative. And then school and classroom will remain open. If a family member of a student or staff member or someone in close contact with a student or staff member tests, or someone in close contact with a student or staff member tests positive for COVID-19. So we would send them home. Contacts will be quarantined for 14 days from the last exposure to the case. Testing can be considered, but it will not shorten quarantine. You cannot test out of quarantine. Our calls with the county on contact tracing, that's what they keep repeating over and over. You cannot test out of quarantine. And then schools and classrooms will remain open. On the next page, George, of that document, you go into scenario 3, a student or staff member themselves test positive for COVID. At this point, it's going to be Bridget, will automatically notify the San Mateo County Office of Health, as well as San Mateo County Office of Education. The case will be isolated. The case meaning that student or staff member will be isolated and excluded from school until at least 10 days have passed since symptoms first appeared, and at least 1 day have passed since the last fever without the use of fever-reducing medication and symptoms have improved. If the case has not had any symptoms and remains symptom-free during his or her isolation period, the case still needs to wait 10 days after the positive sample was collected before they can return. If the case is initially asymptomatic and develops symptoms during the isolation period, then the case will be isolated and excluded from school until at least 10 days have passed from the time the symptoms have arisen. And then, of course, 24 hours have passed since the last fever without medication. And then quarantine and excluded. So if a student has COVID, they have, I believe, 7 classes. All those 7 classes that student was in, including the staff member, will be quarantined for 14 days after the last day that person was present at school while infectious. We will, if there are specific and unique situations, we will have Bridget reach out to the county health office to ask these questions, and we work with the health county to identify and answer any questions that we can for the staff member or students or any of the quarantine students. Let's see, testing of contacts can be considered, and Bridget will work with whoever the case is in the quarantines to recommend testing. Of course, you cannot test out of quarantine, so regardless, we will then thoroughly clean and disinfect all the rooms where that person spent some time. And for now, since we're outdoors for lunch, obviously that's outdoors, that's not disinfectable, but indoors, any classroom that student was in will be fully disinfected. Other cohort pods will continue in-person instruction. The entire school does not need to close if there's 1 case of COVID. We will also be sending out an exposure. The people in the cohort will receive a notice that is a quarantine notice with detailed instructions of what to do and how to quarantine. And that will go to each cohort that will be quarantined. And then the entire school will be receiving an indirect exposure notice so that they know that there is a case. And we will comply with the 24-hour requirement as set by this, I believe it was the state law. On the second table here, what to do if, say, a kid has a cold, but they've taken a test and it's not COVID. A symptomatic student or staff member, they've tested negative, and they had a household contact. They were a household contact to a case. So let's say that student tests negative, but their parent has COVID. That student and staff or staff must remain in quarantine for a full 14 days after the COVID-19 positive household member completes his or her isolation. Again, one cannot test out of quarantine. If a symptomatic student or staff member tests negative for COVID-19 and was a non-household close contact to a case, they will also be required to quarantine, and they cannot test out of quarantine. And if a symptomatic student or staff member tests negative for COVID, but has not been exposed to any close contact and close household contact, the student and staff, student staff will remain in quarantine. Let's see, all right, so a symptomatic student or staff member tests negative without close contact, as we said, Student staff may return to school based on the diagnosis and instructions given by healthcare provider, and we will have our school nurse work with that family to ensure that these protocols are followed and that we are comfortable having that student return to school after their symptoms have passed. And let's see, on to the next scenarios. An asymptomatic student or staff member tests negative for COVID-19 and was a household contact to a case. Student and staff must remain in quarantine for 14 days. If an asymptomatic student or staff member tests negative for COVID-19 and was a non-household close contact to a case, they must also quarantine for 14 days. If an asymptomatic student or staff member tests negative for COVID and has not been around anybody who they are aware has COVID, they can return to school immediately. And that's, of course, their test is negative, they don't have any symptoms, they can continue like normal. A symptomatic student or staff member who is not a close contact to a known COVID-19 case tests negative for COVID-19 after the first scenario, which we went through. Here is where we will call in Bridget to work with the family to work and decide whether or not that student can return to school. And anybody who's had, the next scenario is anybody who's been a close contact, they have to quarantine, is what this is saying, this last scenario here. So this document can be very confusing. It takes quite a few times to read through it. And so I recommend go ahead and read it a couple of times on your own. It makes more sense as you start thinking of these scenarios and walking through them after you've read them a few times. There's also trainings if you're interested on how the contact tracing will go. You can attend webinar trainings that are located on the San Mateo County Office of Education. But for the big picture, Bridget is going to be handling all of these contact tracing, quarantine, all of this work for us. All right.
Carolina, there's a couple questions related to this if you want to.
Yeah, let's take the specific questions. I think some of them have been answered, but it would be good for you to look at them, Carolina.
Okay.
So one of them did. Oh,
actually, let's go for it. Yeah, perfect.
Okay. So one of them did ask if a student tests positive, would all 7 teachers also be quarantined? That is, yeah. And then also a question about subs with that. So yes, they would be quarantining the 7 teachers, but one main duty of the COVID team is subbing classes. And then also all non-teaching staff are available to sub at any time.
There's a question, if a cohort is quarantining for 14 days, will teachers still be required to teach via distance learning for those 2 weeks? If a teacher is, and I'll go through this in the next couple of slides, if a teacher is quarantining and is able to continue teaching, we will have a substitute, like Rachel said, a COVID associate substitute in the class with any students that are in the class. And if the teacher is able to, we would recommend that they continue teaching from home or wherever it is they are. Were there others?
And if a student has symptoms and they're sent to the nurse, they would be sent home. And yes, the COVID test does take a couple days, but if they have any symptoms, they would be expected to stay home. And if the symptoms are not severe, like they're not severely sick, obviously they could continue with online learning. So they would not be allowed back on campus unless their symptoms were fully gone.
And only at 24 hours after that.
Yeah. Yeah.
Were there others, Rachel, on this specific topic?
Well, it's a practical question, Carolina. If a student proves to be infected and is passing in the hallways, how will that be determined? I mean, it's not, typically it's not going to be defined as a close contact.
Right, it would be considered an indirect contact. You would have to be with that, within 6 feet. Here, as it says, close contact is a person who is within 6 feet of a confirmed case for more than 15 minutes, regardless of if they're wearing masks. Now, if somebody's passing you in the hall, I mean, just like if you're passing somebody in the grocery store, maybe they're asymptomatic for COVID, you know, you're still an indirect contact. And so anybody in the hallway would not have to quarantine. It would just be the person that was really spending the time with them in the classroom that would be quarantining. One thing I do want to say here, of all the schools that have reopened in San Mateo County, there have been students on various campuses that have had COVID. but there has been not one case of any spread. And this has been confirmed by the county to us as recently as, I think yesterday, where they confirmed that there has been zero spread at schools. And all the people who have quarantined in these cohorts and pods, none of them have tested positive as a result of that COVID case on campus. So that goes to show that these 4 pillars that are being put in place really are meant to prevent you from contracting it, even in the classroom with them. All right, let's move on to the next slide here. Okay, so our newly hired COVID associates will be the first in line.
Can I just ask, practically, is there going to be a way to save these questions? Because or at the end, I think we need to look at people's energy levels and to go through some of these questions at the end.
Yeah, so we'll go through all the questions at the end, and then I'll work with George to see if we could save them. Okay. All right, so moving on. Our newly hired COVID associates will be the first in line to handle substitutions. Each of them can serve as one teacher for all of their classes. From there, we will ask our staff and admin team to serve as substitutes. Only if needed, and I don't really see this happening, but only if we need to, will we ever ask a teacher to perform a substitution this spring. If someone is out on quarantine or out with a minor illness where they can continue teaching remotely, that faculty member will teach remotely, and there will be a substitute in the classroom. They don't need to take any sick days. There is no sick days that you need to take if you're teaching from home because you are quarantining. If someone is out sick and unable to teach remotely due to illness, now you could possibly have a sinus infection and possibly still be able to teach. I'm just giving an example, teach remotely while you wouldn't come onto campus because you would have a sinus infection. And we're asking everybody who's sick to not come into campus. You can continue to teach from home. We will have a substitute in there. Now, in the case, if someone is out sick and they're so sick they are unable to teach remotely due to illness, we will provide a substitute in the classroom, and we will work with Linda on how to get the materials best presented to the students. The sick time is detailed on your contract. However, if a faculty member ends up getting COVID and isn't able to teach, they will receive an additional 80 hours of sick leave in addition to the sick days in their contract. So that is additional sick days that they would receive for that point. There's also a point where if we have, say, 7, 8, 9, 10 teachers out, it may not make sense to keep the school open for those 2 weeks while they're quarantining. There might be a point where we go back to distance learning because we just don't have enough substitutes on hand to fill the classes and to ensure this proper supervision of passing periods, entrance, exit, etc. All right, George, next slide. Here are some other kind of points. Students will need to leave campus every day at their designated departure time. Students will not be allowed to stay on campus after the end of their last class. We know that in the past, parents have left their kids here. We are going to be very, very strict with this policy this year. So much so we'll have head of school calling the parents saying, we are going to move your kid back into distance learning if this happens again. They are not allowed to stay on campus. All shared areas are closed for the time being, faculty, staff lounge, parlor, etc. The parlor is actually going to be used as a corner of it as a portion to hold kids while they wait to get picked up if they have some sort of symptom and it's raining outside. If you would like coffee for now, and this is just for now, please bring a thermos from home. We are going to try to figure out a way to implement a safe serve process for coffee service for faculty and staff through Epicurean, but we first want Epicurean to focus on fully implementing our lunch model. But then I promise we will work with them on trying to find a way to get you some coffee or tea. One other point, we have been working with families on financial aid to provide any tech their daughter may need during distance learning. Parents are also going to be reminded that this is available to them at the upcoming parent required trainings. Okay, next slide. Resources. So all of this stuff will be located on our website, and that's the link to the website. We have touched on key points in COVID policy changes in this document. Updated faculty policies on COVID-19 in its entirety are available on our website. We've gone through some of the changes. I mean, the COVID guidance changes quite a bit from time to time. They could be adding new symptoms. They could be changing certain mask things. And because of that, updates on the COVID-related policies have to be updated. And we will continue to do that as soon as when we receive guidance from state and local government. And then as soon as we get those changes made, we will then apprise you of those changes, maybe through a webinar. If it's something small, we might just send an email, but we will get that information to you when those changes are made. And then again, we are finalizing our Cal OSHA documents at this time, and we are going to be posting them on our website in the upcoming days. Our documents have been reviewed by various authoritative bodies at this point, including a specialist of OSHA from our insurance company. And they have okayed everything in our plan, and we are just finalizing the document to post on the website at this time. All right, so now it's Q&A. So let's go through some of these questions. All right, can we get more details on the counting getting better? Everything I read says otherwise. Bridget, I think you had mentioned this in your presentation. I know that we are starting to see the downward trend from the Thanksgiving surge. That does not mean that necessarily the surge will not re-arise when it is time to, when these Christmas and New Year's time hits. We expect there's probably going to be another surge. But at this time, the surge from the Thanksgiving holidays is going down. Bridget, is there anything else you want to add to that? Let me unmute you here. Let's see. Actually, if you could unmute yourself, Bridget.
That was really important what I just said. One of the things that we find in the state is that they keep changing the goalpost, not moving it, but changing it. First of all, we were in a color tier, and now we've hit the purple in the color tier. And San Mateo County was the last one in that purple tier. Then the other thing is positivity rate. That was really important for a while. Then we went on to ICU percentage, where they wanted us to be above 15%. And then the last one, most recent, is number per 100,000. And they wanted us to be under 28. Apart from the tier, we are seeing some improvements, even though if they're small. You know, the ICU beds went from 2 to 3%. That seems really, really small, but we are talking about a big number of beds. So exactly like you said, Carolina, is that we are seeing a downward slope. The last 4 days or 5 days, there's actually been less cases in San Mateo County, but we're just waiting for that to come back up. And we're aware that, I think what I'm trying to say is that, know that I'm aware of it, I'm monitoring it, and I'm sharing the information.
Excellent, thank you, Bridget. I received notification this morning that the San Mateo County Board of Supervisor President wants all in-person learning to be halted because of the surge in numbers. Has this been discussed? From what I understand, the president, he needs 3 votes on the County Board of Supervisors. If that happens, it will be halted. And of course, we all have to comply. And so as further information comes out about that, we will absolutely discuss it.
And that information is from Marcy Dragon, who's a senior legislative aide to the Board of Supervisors. So it comes from, pretty reliable authority.
All right. Is there a particular style of smock or outer covering that is best? I'm going to throw that over to Bridget here.
Yeah, no, the thing is it's the barrier, right? So if you have, 5 big, comfy shirts that you like to wear, well, just make those, just appoint that object. So I have nursing smocks, and I actually bought 2 that were jackets. So they're a little bit warmer, and that's what I'm using. So really it's any piece of clothing that's going to separate the rest of your clothes, your at-home clothes, from your work clothes. That's really the big thing.
All right. Any information regarding the possibility of teachers getting the vaccine? How will we be notified since we are in the next year? Information that we received from Marcy Dragon as well on this particular topic. All of the schools that are in-person hybrid learning, those schools that have students on campus and in-person hybrid learning, the county is in the process of determining and prioritizing those teachers and staff that have the in-person hybrid learning going. So the teachers that are going to get the vaccine first will be those that are in person, and then the teachers who haven't reopened schools, those will be on a lower tier from San Mateo County. They have partnered with Safeway, I believe CVS, and another, oh, I can't remember the third one, another entity.
Safeway and CVS are the big ones.
Okay, Safeway and CVS are the big ones, and that's how they are going to be distributing the vaccine in San Mateo County to all of our San Mateo County teachers that are in-person hybrid learning that have reopened. All right, will faculty, staff, children using NDB childcare be allowed to be tested on campus every week? Yes, absolutely. We will test those students on campus every week once they start. Okay. Oh, your Abby Vega's phone doesn't work in room 251. I will investigate and get you a solution. All right. The teacher bathroom upstairs, is it closed? You can use the other bathrooms. You can use the teacher's bathrooms. They will all be disinfected. Instead of calling, could we all download Slack to request bathroom breaks? It would be faster and less disruptive to teaching. Just a thought. I agree. I like Slack. I think it's going to take us possibly a little bit of extra time to kind of get it on everybody's system, contract with the provider that provides Slack, enter into an agreement with them, and then get it downloaded. But I love Slack. I think it's a great idea. And Rachel and I were talking about it one night over the holidays, and she came up with that idea. And I said, hey, that's great. Do you think we could get it done this quickly? And she's at this point, we don't have it done. We are looking into it. But yes, I like Slack.
I think for people who have tried to use Google Hangouts, that might be a good way to chat as well, since everyone already has their email open, likely. So we could look into that as well, and then we don't have to download a whole nother system.
Okay. So we are still looking into that and what's the best way, least disruptive and easiest way to get information there. If there isn't a walking pathway for students to get up from their desk and leave the room without getting within 6 feet of others, are they still allowed to go to the bathroom? Yes, I mean, it's a quick pass by. They're not going to be standing close to another student for longer than 6 feet. So yes, they can easily walk by a student, just like you would walk by people like in the hallway. It's just someone's walking by. In the basement where there are a few classes, how will students be monitored coming into the room? There will be classes on every block on A days, and students will need to be kept apart from each other while waiting to come into the room. Also, when they realize the system will stop them from hanging back so that they can be closer to a friend, not wanting to come into the room first. Okay, so we have hired 5 COVID associates, and we have all staff administrators on campus and non-teaching faculty that will be doing supervisions. They will be literally in the hallways and the basement, the first floor, the second floor. And they will be outside monitoring these students to make sure that this exact thing does not happen. There will be people stationed in various locations so that we can catch anyone who is trying to loiter with other students closer than 6 feet. We will have people there. When I measured, Claire, your desk question, I'll go to your classroom. Let's talk with Raphael and let's see what type of configuration works best for you. But yes, let's grab Raphael and we could talk configuration. All right, how are counselors supposed to support students if students cannot see us? Can we go to their classroom, take them outside 6 feet apart if we cannot chat more than 10 minutes? And a student is in crisis, what do you suggest? How are we as counselors expected to connect to students if we cannot talk to them? Visits are on Zoom, why are we on campus? Okay. So
I think that Linda shared yesterday, Carolina, that she talked to counselors about that and looking at the possibility of walking with them outside, maintaining proper distancing, making sure that their other people are not around when they're having a conversation. So I think that's my understanding of what was discussed with counselors.
Okay.
And I think that's a good idea, unless the two of you,
nope,
Carolina, Rachel, see a problem with that.
No problem. It sounds good. And the reason we're on campus is so that we could support the supervisions that are needed. I understand we as adults will not be gathering in groups of 6 or more, but we have class cohorts larger than 6. How are we handling those larger cohorts? So we're not gathering with each other as adults for the sake of the utmost kind of caution. There are classes that have classes larger than 6. And as long as they're spaced 6 feet apart, they're wearing masks, the ventilation is going, that is acceptable under the San Mateo County 4 Pillars framework. The reason we're not gathering as a group faculty members is just out of the most extent of caution. And of course, after 6 weeks, we're going to look at this. Things are working well. We may consider doing smaller gatherings at first and then possibly slightly larger. But for now, we're really going to focus on in-classroom instruction as being the most important thing. Okay, what will happen on rainy days when we decide to do online school and food has already been ordered? Can we donate the food to a food bank? So I know that Epicurean they have a relationship with a food bank and others. There's certain concerns about donating food that's already been cooked. If there is a special way that they have to handle it. And if they don't have that in place, they may not be able to donate it to the food bank. We will talk with Epicurean about it and see if they can do something like that for us on rainy days. To clarify, for some reason we cannot make our supervision, we have to find our own replacement. We'd like it if you could find your own replacement. If you're struggling to find a replacement, I think it's Patsy. Work with Patsy and she'll help you out. But it would be easier, obviously, if you could try to find your own replacement. If you can't, talk with Patsy, who will be monitoring supervisions schedules. If a teacher doesn't teach a 4th or 7th block, can they leave and remove themselves from the germs on campus, especially if they may have to move into a shared office space with another staff person, or do they have to stay until the end of the day? If you do not have a supervision, like I said in an earlier one, if we find problems with we don't have enough people to monitor arrivals and dismissal exits in the parking lot, we may ask a teacher to, if they don't have a block that last period, we may ask them to help us supervise. But of course that schedule comes out a week and a half in advance. And of course, if you're not on it, then yes, by all means, go on and end your day. How early can we come on campus? I guess as early as you want to. Just remember, if no one's here, you must send your screening check mark over to Barbara. I believe we answered if somebody if the infected student was passing in the hallways. So yes, that's not a close contact. That's not an issue. They would not be considered a close contact, so there is no quarantining necessary for that. So to clarify, if I'm not feeling well, I have a cold, I will stay home and teach online from my classroom, and this will not count as sick days. If you are sick, you should not come to school. You continue teaching from home. That is fine. That will not be a sick day. Anybody who has any type of symptoms, Bridget will be reaching out to you to ensure that the symptoms that you are feeling aren't in line with COVID. Out of the utmost conservative approach, she's going to be contacting everybody who is out sick. Let's see. So yes, don't come to school if you're sick, please. If I get COVID and I am sick, let's see. If I get COVID and I am sick with it for 10 days, does that mean I only need to quarantine for 4 more days to make a total of 14 days? Or do I quarantine for 14 days after I am sick? So if you're sick, it's at the symptom onset date, if you actually have symptoms. So you will have to quarantine from the start of your symptom onset date for a minimum of 14 days. And from there, you will still stay off of campus for 24 hours and be fever-free after your symptoms have passed. And remember, the 14 days includes weekends and all that. So yes, let's see. For those of us sharing a classroom, will we have to quarantine if a student in the other teacher's class, but same room tests positive? No, you will not. So say that student was a case and had COVID, but you were not that student's teacher, you would not need to quarantine, just the teacher that was their teacher. If that makes sense. Okay, I need to drink frequently while I am teaching. Can we use a straw to drink under our mask, or must we always step into the hallway? I'm gonna leave that to you. If there's a very safe way for you to do that, I don't see the problem with it. Maybe face away from the students for sure. Okay, students will be encouraged to use the bathroom during class time. Students must still follow the one-way path around the school. How long should we expect a bathroom trip for students to take? I can imagine that some students will start taking advantage of this time out of class. So we're going to have actual, I hate to say this, but bathroom monitors in the hallways, hallway monitors sitting there the entire time to ensure that students aren't loitering and that they are in fact going to the bathroom. And we're also having people monitor the bathrooms, that no more than 3 students are in the bathrooms at a time, and that anybody who's waiting is standing on the 6-foot distance circles. And we're only going to allow 3 people then to wait there. How long will it take? I mean, I don't know. I guess it depends on how long it takes them to go to the bathroom. With the monitor will be there to ensure that they expedite their time as quickly as possible in the bathroom. Let's see. Rachel, when grouping the classrooms for dismissal, I recommend not dismissing 263 and 264 at the same time because there is a bottleneck in that area.
Got it.
Okay, I will ask Rachel to look into that. Thank you. I don't have a room in my phone either, 118. Okay, Rachel, can you make a note of that so we could work with Joseph on getting a phone for that room?
Yes, I can do
Okay,
that.
Google Chat works the same way. If we're trying to connect with one another, it's free and we already have it. Great, we can use Google Chat. We'll have Barbara keep it open. Yes, we'll look at the classroom phone in room 255. So Rachel, can you put that on your list as well? This isn't a question, but more of a suggestion. After chatting with my freshies yesterday, many of them are super nervous about moving around the school with the restrictions coupled with the fact that they don't know where things are in general. Is it possible that when they come back to campus to get tested next week, it could be organized that they take a tour of the school with their cohort and get a feel of their schedule? That way there is a smoother transition when we return, and I know it would help with their anxiety. Yeah, I think that's something we could accommodate.
Didn't we do that in December with freshmen?
We did it with freshmen, yes, in December, but we could do it again to help them. Absolutely. There's also, keep in mind, there's also going to be hallway monitors, very in the hallways all over the place, that can assist students with any of their questions. There are 2 students that have physical disabilities and are allowed to leave, arrive late from class. Do we have pathways for them planned to accommodate them if they are on campus? Yes, let's have this conversation with Linda. We will accommodate. We could have a COVID associate meet them and walk them to class. But why don't we have that conversation with Linda as to how best to accommodate her? Let's see. We need phones in the sculpture room as well. Great. We will look into that. If you, Rachel, can put that down on your list. Room 256, take a look at the phone. We will absolutely take a look at the phone. In room 256. Room 118 has an adjacent office. As I recall, there was a working phone in that space. I checked there first. Oh, okay. So check the office next to room 118. I think they're connected. And let's take a look to see if that phone is one you could use. All right, and that's all of our questions. And we have answered, I believe, 50 at least of all of the questions. All right, thank you, everybody. Please take a look at our website. It has a lot of resources, and we're going to be adding a lot more as the week goes on.
Presentation's on the webpage now.
Right. And I want to thank you all for your time. I appreciate it.
What was the question that was not, there was a question about?
It was more of a statement on comfort level survey. And so I think it relates to issuing a survey. I'm going to let that question be answered as part of hybrid instruction and not as part of the protocols. I'm answering protocol questions here, but the hybrid instruction, you could go ahead and ask your question there on that next training that we have. All right, everybody.
Conversation, but I would respond that there's been an invitation and individual conversations with any teachers to find out where they were and what was their comfort level. So.
All right. Well, we are now at 10:15. I think it was supposed to end at 10. I apologize for going a bit over. I hope this presentation, which I believe, and correct me if I'm wrong, George, is now on our website, on our COVID page.
Yes, and
Yes.
Apologies, Catherine, about the pinning. It was a learning curve for the technology.
So this presentation is now on our website. You may access it at any time. The recording will be uploaded at some point as soon as George is able to get that recording together. and uploading it. So I appreciate, thank you everybody for your time.
Good job, Carolina and Rachel, and I'm drawing a blank, Bridget. So we were scheduled to begin the next hybrid training at 10:15. Linda has moved that to 10:30 to give everyone a break, and I know that link has been sent. So Carolina, some people lost your audio, so the presentation is on the website on the COVID resources landing page.
Yeah, it's called reopening presentation under that section.
Okay.
And the recording will be placed there as well, but it takes about, I would guess, 2 hours or so to upload it back to the website.
And the presentations under faculty, staff policies and protocols. It's the 4th bullet point down. It's called faculty, staff, school, health, and safety reopening presentation. Thank you everybody for listening to this long presentation and for your time. I really appreciate it.